Hi everyone and good evening. I'm Mike Cohen, Ismp President, and welcome to the 24th Annual Cheers Awards. We are honored to have you join us for our virtual awards ceremony. And tonight we'll be recognizing healthcare organizations and leaders who've demonstrated extraordinary commitment to advancing medication safety. Our theme for Cheers this year is Path to New Beginnings. The last year has been challenging for all of us, to say the least, as the pandemic has continued to unfold in ways none of us could have fully anticipated. We've been able to meet the new unprecedented challenges head on by the entire healthcare community working together. Everyone joining us tonight is dedicated to finding ways to continue advancing medication safety, and we're all hoping for a brighter future. I'd like to stress that ISMP is not able to keep moving forward without you, our loyal supporters. When you submit our reports, read our newsletters, put our advice into practice, make changes to your products, or make a donation, you help us to achieve our common safety goals. You're what sustains us through challenges and change. Unfortunately, this year we faced the loss of two well-loved members of the Ismp family. As many of you know, my wife, Hetty Cohen, who was recently honored in the American Journal of Health System Pharmacy for her safety work, and Ron Littman, our esteemed medical director, were both lost, and they are deeply missed every day. Our ISMP family has grown this year as well, as we've added two new members of our staff. Rita Zhu, who has done a fantastic job as Vice President of Operations, and our new medical director, Dr. Kelly Schultz. Now, I'd like to update you on some other ISMP highlights from 2021, including our work addressing safety issues related to COVID-19. First, we urge vaccination sites to take steps to prevent mix-ups between pediatric and age 12 and up formulations of the COVID vaccine. And we also issued a national alert network warning about potential mix-ups between the COVID vaccines and this year's influenza vaccine. We launched the ISMP Medication Safety Self-Assessment for perioperative settings to help hospitals, ambulatory surgical centers, and other surgery settings evaluate their current systems and practices and document regulatory compliance and compare the results to those of demographically similar organizations. We were the impetus behind a two-day FDA public meeting on improving investigational drug labeling, and that resulted in the release already of an FDA draft guidance on investigator safety reporting responsibilities. And next, we held two of our own national invitational summits virtually for the first time ever on sterile compounding and another one on perioperative medication safety. The input gathered will be used to update and create ISMP best practice guidelines. And we were referenced in a Joint Commission Sentinel event alert on optimizing infusion pump safety with dose error reduction software. The alert mentions ISMP guidelines and recommendations and quotes staff. We advocated for better ways to achieve justice, learning, and improvement in patient safety following the Tennessee Board of Nursing's bad decision to revoke the license of a nurse involved in a fatal medication error and require her to pay fines and prosecution costs rather than focus on the systems involved. We just this week issued a joint announcement announcing that starting in 2022, the Just Culture Company will award 3 annual scholarships to honor our own Judy Smetzer, who's been a tireless advocate for just treatment of healthcare practitioners, as well as advancing continuous improvement of medication use systems. Again, a big thank you to everyone who helped make these achievements possible. Before we begin our awards presentation, I did just want to ask you to please stay with us for the entire program, since we'll be mentioning some additional special news tonight at the very end. Each of the individuals and organizations we're honoring tonight has left their footprint on the path to advancing medication safety. They hail from a wide range of backgrounds and from around the world, including as far away as Ireland and Pakistan this year. The dedication and innovation all of them have shown gives us all some incredible role models to follow in our own journeys. Our first winner is the City of Hope Protocol Content Administrators team.
City of Hope Protocol Content Administrators. The City of Hope Cancer Center's Protocol Content Administrators team is receiving a Cheers Award for their work in promoting safety by ensuring the accuracy of all investigational treatment plans. The City of Hope Cancer Center, which is located in Duarte, California, typically has more than 700 clinical trials open at a time. The team conducts a comprehensive review of every clinical trial protocol, as well as lab and pharmacy manuals for discrepancies that could lead to medication errors. They also review and customize each patient's treatment plan in the electronic medical record to help prevent errors and increase transparency, efficiency, and continuity of care. As of July 2021, the team has made 493 clarifications, mostly in protocols. More than 20% of those clarifications have had a positive patient safety impact.
Hello, my name is Vivian, and I'm joined by my colleague Sarah today. We're so honored to be chosen as a 2021 Ismp Cheers Award recipient. Currently, there's a lack of literature in clinical trial-related medication errors and interventions. While these studies do have oversight, our team's unique position has allowed us to collect data, which shows that there's more work to be done to ensure that assessments and medication information are clear and accurate across all study documents. This is truly a critical unmet need, as investigational drugs have great potential to cause harm. Our Clarifications and Interventions project really highlights the importance of reviewing therapeutic oncology and endocrine study documents to prevent medication errors and promote patient safety within the clinical trials research space. Our future goals are to publish our findings after 1 year of data collection. We would like to deepen our participation within the protocol writing process of investigator-initiated trials to proactively prevent discrepancies that have potential patient safety impact, as well as explore membership in the pertinent institutional committees involved in approving research studies. We would like to thank City of Hope and our research operations leadership for prioritizing patient safety within clinical trials and establishing the Protocol Content Administration team. Their continued support, encouragement, and recognition of the importance of exploring innovative methods to enhance patient safety have been paramount to our success. And lastly, thanks to our 11 team members, a mixture of nurses and pharmacists, who make it their mission every day to ensure that we deliver safe treatment plans to our clinical trial patients. We would like to thank Ismp again for this award, and we are truly humbled and honored. Thank you. Thank you.
The City of Hope Protocol Content Administrators team highlights the importance of having clinical study personnel dedicated to a comprehensive review of research documents prior to the start of a drug trial. And their work is a testament to the power of collaboration in medication safety. As they work with pharmaceutical trial sponsors, investigators, and other research personnel to review research documents and reduce the risk of harmful errors. And we at Ismp are proud to honor them tonight. Our next award recipient is Innova Health System's IV insulin team.
Innova Health System. Innova Health System's intravenous insulin team is being recognized with a Cheers Award for their persistence in improving the safety of IV regular insulin administration. Innova is a leading nonprofit healthcare provider in Northern Virginia. The system's pharmacy medication team collaborated with other disciplines to implement error reduction strategies, including restricting regular insulin to the IV route and requiring regular insulin prescribing via order sets with dosing limits. They also ensured that orders for IV push regular insulin include an image of the appropriate syringe to be used in the medication administration record. Many ISMP tools and guidelines have been utilized during the process, and over the last year, there has been a significant reduction in severe hypoglycemic events.
Hello, I am Laura Monroe Dupre, Pharmacy Medication Safety Team Lead and Regional Pharmacy Director for Inova Health System. First and foremost, it is a distinct honor to be recognized for Inova's medication safety work by ISMP, the preeminent global medication safety organization. ISMP's commitment to medication safety makes a difference in millions of lives every day. We are very proud to be part of the Inova team, which is relentlessly dedicated to patient safety and is on a continuous journey to excellence and high reliability in healthcare. Inova's multidisciplinary team, consisting of endocrinologists, pharmacy team members, nurse educators, nurse leaders, supply chain partners, and especially the EPIC Inova team, has spent the necessary resources to respond to an IV medication error as a system. Frontline nurses are instrumental in the ongoing success of this process. Inova's pharmacists, technicians, and leaders manage the medication use process across the organization. And for this reason, I'd like to not only recognize these teams, but also our amazing leader, Melanie Messiah White. Excellence in healthcare is an ongoing journey, and hardwiring the processes for these safety journeys takes not just a team, but really a village. It is our honor to share our work with other organizations across the world through the award that we're receiving today, and also through subsequent publications. Thank you, ISMP and Inova, for all that you do for patients every day to keep them safe.
Although the strategies of Inova's team and what they use to improve the safety of regular IV insulin administration weren't unique, their persistence in achieving their goal sure was. They have remained focused on safety improvements despite having to pause the project for months due to a COVID-19 surge. At the beginning of 2021, all units had consistent access to Luer-Lock syringes in their automated dispensing cabinets, and more than 80% of their nurses were drawing up insulin in these syringes. There's also been an 80% decrease in the frequency of unclear and questionable orders. We're happy to recognize the Inova Health System's IV insulin team for its dedication to improving medication safety. For decades, the Beers list has helped guide safe medication use in the elderly population. The next Cheers Award goes to a dedicated effort to create a similar list, but for pediatrics.
Kids List Collaborative. The Kids List is being honored as the first available list of drugs that should be avoided or used with caution in pediatric patients. In 2017, the Pediatric Pharmacy Association commissioned a team of pediatric pharmacists to compile a list of drugs potentially inappropriate for use in pediatric patients. The goal was to improve the safe use of medications in pediatrics and inspire future research on medication safety in children. After 3 years of literature review and gathering expert opinions, the Kids List was published in the March 2020 issue of the Journal of Pediatric Pharmacology and Therapeutics. The article is open access and free for the entire healthcare community to use. The Kids List will be updated every 5 years, and the team intends to include other healthcare disciplines in the development and review of future versions.
On behalf of the Kids List Author Group and the Pediatric Pharmacy Association, it's my pleasure to accept the ISMP Cheers Award. It's an honor to be recognized by ISMP for having made a material difference in the safety of how medications are used in pediatric patients. I'd like to specifically thank my co-authors on the Kids List, Rachel Myers, Jennifer Thackeray, Kelly Matson, Chris McPherson, Lisa Lubsch, and Robert Halinga, for their dedication to the project, their willingness to be outspoken and passionate, yet humble enough to see others' perspectives in order to achieve a greater vision. Thank you to Executive Director Matt Helms and the PPA Board for commissioning the Kids List project. Use of the association's time, resources, and membership were critical to its success. I'd like to thank the Journal of Pediatric Pharmacology and Therapeutics, in particular, the expert and extraordinary editorial support of Stephanie Phelps for shaping the manuscript into its final polished form. Thank you to Wolters Kluwer for providing the author group a searchable format of their Lexi Drugs databases. Thank you to ISMP, PPA, the Academy of Neonatal Nursing, and the National Association of Pediatric Nurse Practitioners for your input and endorsement. Finally, my deepest gratitude goes out to the members of PPA and the many other individuals that took the time to critically evaluate and review the manuscript, provide constructive feedback, and graciously exhibit patience with the authors as we responded to your comments. Thank you.
The Kids List Collaborative is an amazing example of a group that identified the need for a new medication safety resource and was willing to undertake the long journey needed to create it. The collaborative team worked for almost 3 years, reviewing the literature and gathering expert opinions while they drafted the list, which, by the way, contains 67 drugs or drug classes and 173 references to help providers make clinical decisions. We applaud this impressive ongoing effort to create a brighter future for pediatric medication safety. Our next set of the winners, the creators of the Medication Safety Minute series, are one of 2 overseas healthcare organization teams being honored tonight.
The Medication Safety Minute. The St. James's Hospital Medication Safety Minute team, based in Dublin, Ireland, is receiving a Cheers Award for their innovative system of delivering weekly micro-learning sessions related to safe prescribing. The team developed a 2-slide presentation for each safety minute that hospital physicians with limited time can access at their convenience. Each safety minute consists of a question or teaser and an answer. From the start, the safety minutes have been made available to a wider audience. They are used by 24 additional hospitals in Ireland, shared with undergraduate and postgraduate students at local colleges, and shared on social media with a dedicated Twitter handle. Over the last 4 years, the team has created and distributed 126 weekly safety minutes, which are available as a free online access resource in the form of a digital flipbook.
We're proud to accept this award on behalf of St. James's Hospital and Trinity College Dublin, on behalf of our frontline prescribers and other staff, and on behalf of our patients. Our mission at St. James's is to provide best care for every patient, safe, responsive, excellent, person-centered care. We're a teaching hospital, but we are also a learning hospital. Medication errors are common in all hospitals, and we encourage a culture of disclosure and reporting of all errors. Our efforts to share learning from individual medication errors with all frontline prescribers have resulted in the Medication Safety Minute. Each minute is derived from a real-life situation, distilled into a simple question and answer format, and should take no longer than a minute to review. We hope that using micro-learning in this way will help busy frontline prescribers and staff to keep abreast of important pitfalls and potential errors in the medication process and improve medication safety for all patients. The Medication Safety Minute started as a local initiative, but it has grown steadily over the past 4 years, is now circulated to most hospitals in Ireland, and is accessed widely internationally via Twitter by a following of over 3,000 organizations, agencies, and individuals. We have a small faculty of 3 to oversee this initiative, but Una and I wish to acknowledge that the person who does the real work in the engine room is our very knowledgeable, extremely meticulous, and immensely resilient pharmacist, Eileen. Thanks to our colleagues and executive at St. James's and Trinity College, and to the faculty of the Diploma in Leadership and Quality at the Royal College of Physicians of Ireland, who have all supported this initiative. And finally, thanks to the Institute for Safe Medication Practices for acknowledging our efforts with this award, and most important, thanks to our patients who teach us so much every day.
Finding a way to share important safety information with busy physicians can be challenging. The Medication Safety Minute team found a better way to make it happen and they've developed quite an audience. It's truly impressive that they currently have more than 3,000 Twitter followers, including ISMP, and their digital flipbooks, and they've been read by more than 13,000 people. 13,000 times, that is. We're proud to recognize this innovative effort to make crucial medication information more accessible and memorable. Ray Muller, who is being honored with a volunteer award tonight, has been one of the first healthcare professionals to alert ISMP about safety concerns with new oncology medications entering the market.
Raymond J. Muller, RPH, MS, FASHP. Ray Muller is being honored with a volunteer award for his decades of altruistic service to ISMP as a clinical advisor on oncology-related medication errors. He has helped address dozens of potentially harmful issues, particularly with packaging and labeling and look-alike drug names. Ray was instrumental in helping ISMP publish a series of newsletter articles on significant product-related issues with investigational drugs and develop practical recommendations and solutions for the FDA, clinical trial sponsors, and clinical trial sites. In addition, he joined ISMP in influencing FDA to recommend mini-bag administration of vincristine and to remove syringe administration as an option from the approved prescribing information to prevent inadvertent and deadly errors.
Sincere thanks to ISMP for this award. I had the incredibly good fortune to meet Mike Cohen almost 45 years ago when I started a pharmacy practice residency at Temple University Hospital. Seeing Mike Cohen practice true pharmaceutical care every day crystallized my ambition and goal to ensure the safest patient experience. Mike was the best mentor I could have had. He developed my clinical skill set and turned me on to the vitally important role that a pharmacist should play as a medication safety leader. After residency, I had the fantastic luck of joining Memorial Sloan Kettering. As my career evolved to the point where I've now had the distinct privilege of managing virtually all aspects of our pharmacy enterprise, I've always tried to put patient safety first. During the past 44 years, I've had the true pleasure of working with some of the smartest and compassionate pharmacists and other healthcare providers in the world. In our interdisciplinary pharmacy quality assessment committee, we dissect near miss and actual events in one of the most robust programs in the country. We're also fortunate to have 2 active patients participate in all of our QA meetings, since I firmly believe that patient focus must drive all of our actions. The most important role that a pharmacy director can play is to develop future leaders. I've had the pleasure of working with exceptional preceptors in our medication safety and policy pharmacy residency program for the past 6 years. Sincere thanks to my colleagues in pharmacy leadership and a supremely talented pharmacy team at MSK. Because of you, I've been able to play a modest role in enhancing some national medication safety programs through my volunteering efforts at ISMP. Thank you.
Since the very beginning, ISMP has always been able to count on Ray to provide real-world assessments of safety issues and examples of unsafe practices that need to be addressed. Most recently, he helped us gather a group of leading oncology experts at an FDA public meeting on ways to improve investigational drug packaging and labeling. And his persistent advocacy was a key factor in making that meeting a reality. Ray, our heartfelt thanks for your tireless support and ongoing assistance to ISMP. The Tabard Institute is ISMP's first Cheers Award going to someone from South Asia. Their interdisciplinary team overcame significant challenges to prevent errors with potassium chloride for injection concentrate.
Medication Safety Initiative on Safe Use of Concentrated Electrolytes. Tabard Institute in Karachi, Pakistan, is receiving a Cheers Award for its proactive initiative to eliminate concentrated electrolytes from floor stock and patient care units. The Institute decided to embark on the project after another hospital in Pakistan had an event in which a 9-month-old baby girl died after receiving the wrong drug, potassium chloride for injection concentrate, which was only available in vials on the unit. Hospital leadership fully supported and funded the initiative despite significant challenges, including the fact that commercially available premixed IV fluids containing potassium chloride are not available in Pakistan. The Tabard Institute initiative's success helps increase awareness of the need for similar efforts among international healthcare providers and for affordable premixed solutions to be made more widely available around the globe.
I'm Dr. Bashir Hanif, Executive Director at Tabard Institute. Tabard Institute is a not-for-profit 170-bed cardiac hospital located in mostly densely populated area in Karachi. We have always focused on patient safety and quality, not only in our own institute, but tried to improve all over Pakistan as well in collaboration with WHO. Medication safety remains a huge challenge in a specialty hospital like Tabard Institute and all over the country and all over the world as well. We have taken several initiatives to improve that, especially our pharmacy team has taken several initiatives to improve medication safety, not only in Tabard Institute but all over Pakistan as well. And one of the recent initiatives and efforts was really recognized by ISMP, and Tabard Institute pharmacy team was awarded for taking this initiative. I would really like to thank ISMP for recognizing this effort and encouraging our pharmacy team for these efforts. We will continue to improve our efforts in terms of improving medication safety at our institution as well as over Pakistan. Thank you very much.
Hello everyone and Assalamu alaikum. My name is Sumaira Khan and I'm working as pharmacy head at Tabard Institute, Karachi, Pakistan. With me, my colleagues, Ms. Munazza Qureshi, a clinical pharmacy specialist, and Ms. Meena Mehraj, senior pharmacist, IV admixture room. They played key role in implementing our project. I would like to start my comment with the quote of Holy Quran, and whoever saves a life, he has saved the whole humanity. We are extremely thankful to ISMP for the recognition and selecting us for this Cheers Award. It is truly an honor for us. Taking a quality initiative in a low middle income country is very challenging as compared to the developed world. By eliminating concentrated electrolytes from floor through our IV admixture program, we have achieved one of the highest standards of medication safety. We would like to share our story utilizing all possible communication channels so the other people in the country learn from us. We are extremely thankful to our nursing colleagues, pharmacists, physicians, and hospital leadership for their support, and ISMP for this honor. Thank you very much.
Tabard Institute has shown incredible commitment to learning from a tragic error and proactively taking steps to keep the same thing from occurring in their healthcare organization. But even more than that, they've been totally dedicated to raising awareness about prevention efforts in their country and worldwide. So we are proud to recognize Tabard Institute tonight with a Cheers Award for setting an outstanding example with their passion and determination to advance medication safety. Now, ISMP's Lifetime Achievement Award. This is being given in memory of our late trustee, David Vogel, and it honors individuals who've made a lasting difference in patient safety. We're extremely proud to honor this year's winner, Patty Keenley, a longtime friend and colleague, actually. Here's Patty's introduction and lifetime winner address.
ISMP's Lifetime Achievement Award honors an individual who has had a significant career history of ongoing contributions to patient safety and has had a major impact on safe medication practices. This year, the ISMP Lifetime Achievement Award is being presented to Patricia Keenley. RPH, MPA, BCSCP, FASHP, for her leadership and long-standing commitment to medication safety. Keenly is one of the nation's foremost experts on medication management, as well as accreditation and regulatory issues. She has almost a half-century of experience helping healthcare administrators develop and execute comprehensive medication management programs in acute and non-acute care environments, and currently is Director of Accreditation and Medication Safety for Cardinal Health. Keenly is a former board member of ISMP and the American Society of Health System Pharmacists. She has completed an executive fellowship in patient safety at Virginia Commonwealth University, is a current member and past vice chair of USP's Compounding Expert Committee, and has served on the Joint Commission's Medication Compounding Technical Advisory Panel. Keenly has earned numerous state and national awards, including the ASHP Award for Distinguished Pharmacy Leadership, the ASHP John W. Webb Lecture Award, and the USP Award for Outstanding Contributions to the Standards.
I am so honored to receive this award. No award like this is an individual effort. It's the opportunity to work with great colleagues who have the same focus on patient care. And I've had the delight to work with two great groups of people. First at the Mercy System in northeastern Pennsylvania, and for the last 20 plus years with the Houston group of Cardinal Health. Those pharmacists, pharmacy techs, and all the other support people have a singular focus of making sure that the patient is in the forefront of what we're doing, and that care is so important for that. In particular, the nurses at Mercy Hospital in Wilkes-Barre taught me early in my career what was important for patient care and how we keep them safe. Medication safety is truly a team sport. It's not limited to pharmacists or even to pharmacists and nurses. Look at all of the ways and all of the disciplines, including patients and their caregivers, that we need to be able to use to safely get those medications effectively into those patients. The evolution to ambulatory care for many severe conditions makes it even more important for us to be sure to include all of those professions who may be involved in making medication safety a priority. I'm so impressed with all the other Cheers winners this year. In particular, seeing the recognition of individuals and sites in multiple countries is really gratifying. ISMP, Mike, and all of your colleagues have made medication safety a worldwide emphasis. What a change from what we saw a few decades ago. Well, I like putting suggestions for practice into a small number of buckets, and I have 3 buckets for you to consider for this. What we do individually, what we do in our organizations, and how we can influence public policy when dealing with that. Every one of you helps patients every day. I know you can think of at least one error that you've prevented every day that you work. And even those days that you don't work, when your neighbors and your family ask you a question about a medication. It requires contemporary knowledge and how that all evolves. It's lifelong learning, but not just about the meds, also the way that we safely handle this for patient care. Look at all the pivots we've done in the past 1.5 to 2 years based on as the COVID pandemic has evolved. ISMP has always provided us with straight shooting ways of handling issues, but even thinking of the specifics that we've had to do for the COVID pandemic issues, good catches that we can do, errors that have occurred and how we can prevent them. So they let us know what we can do to help those patients and to really solve some of those problems, so to prevent errors from happening with others. What we do in our organization is essential to promote and to maintain safe practices. I mentioned the nurses at Mercy Hospital in Wilkes-Barre, Pennsylvania. Do you know what your colleagues do? For the pharmacists out there, have you spent a day on a patient care unit? Not just for a med pass, which is essential to see, but also all of the other things that occur there. And the nurses out there, have you spent some time in the pharmacy and with the pharmacist who's taking care of your patients? It's not only the physical work we do, but all of the other things that are sometimes convoluted, those steps that we have to take care of a patient. Knowledge of the process helps us understand why things happen and why those errors may need to occur. ISMP has always provided us with fantastic references For each quarter, that quarterly action agenda that identifies reported errors and the strategies that can be used to prevent them or at least mitigate them in there. And in addition to practice sites, how about having a student review that potential error at your own organization? It's a fresh set of eyes to look at. That's always a valuable approach. But more importantly, it introduces one more practitioner, even if we have to do this one at a time, to the need for a collegial approach to medication safety. I have to mention sterile compounding, and particularly hazardous drugs. Of course, there's this core component that we've always had of when we do as health system pharmacists. The more recent example of errors that have occurred stemmed from not only an error in the components of an IV, for example, but also the microbial contamination that was there. It's a whole new focus that's been brought as to how we need to keep patients safe, but also what we need to do to keep ourselves safe as healthcare employees. We need to be safe from inadvertent contamination of hazardous drugs. This issue continues to evolve, and I'd really encourage you to stay current with that because changes will be coming and improvements will be coming in practices. Well, when I started practice back in the mid-1970s, there was an amazing group of pharmacy practitioners in the Philadelphia area who shared best practices. And this is when I first met Mike Cohen, who was then at Temple University Hospital. These folks had a singular focus, just as I mentioned prior. They were people who were important to know what was going on with medication safety and what other vibrant pharmacy issues could be identified. We learned from each other on this. We need to continue to do that. It's not just the local and regional and national and international organizations that we depend on for this, but every single input that we have to that and the sharing with colleagues is important to keep patients safe. And it's not just pharmacists and nurses and physicians. There are plenty of others who have helped us along and really promoted the medication safety. I can think of a few people who stand out in practice over a number of years. Marvin Sampson, who initiated much of what we do for single-dose parenterals. Bob Braverman, whose family business still guides us in proper packaging and labeling and safe practices in health systems. Mark Neuenschwander, whose focus on automation continues to make us evolve for what we do. I often think, why are we still making IVs the same way we did decades ago? We need to incorporate automation in practice. Chris Jerry, whose personal tragedy, the loss of a child, has evolved into making sure that we focus that safety and we can do it one patient at a time as well as groups of patients. I worry that the way that health systems compete now, at least in the US, doesn't promote us sharing information with colleagues. Even just not only new, but also seasoned practitioners don't have the opportunity to identify what others are doing and what people are seeing safely and the evolution of practice. So sure, medical, nursing, pharmacy, imaging, respiratory technologists, and all of the other student practitioners have multiple rotations, but are they exposed to the knowledge of how medication errors occur and what we can do to mitigate them? Your activities in your own organization can promote this and can help other practitioners as well as patients, and I hope you'll continue to do so. If that's not the approach that's being used in your organization, please consider doing that. Well, what about public policy? I hope your eyes don't glaze over when I mention this, because it's essential to keep our patients safe. ISMP has made tremendous strides with ASHP, with FDA, USP, and other organizations to promote medication safety. Even the Centers for Medicaid and Medicare Services in the US has incorporated medication safety in their regulations. So the accreditation organizations have a focus on that because of that emphasis from CMS, but also because it's the right thing to do and it encourages best practice. That would not have happened without ISMP making sure that this was in the lens of all of those medical practitioners. I know you commit personal efforts to keeping patients safe. I hope you'll continue to do so in your organization and whenever you have the opportunity to promote it in your state or province and country. Thank you again for this humbling honor.
Now, Patty has been incredibly influential in the field of pharmacy and really is a role model for today's practitioners. She has served virtually every capacity during her career, from staff, managerial, and director roles in a large healthcare organization to a leadership role at a multinational health services company. She's also been extremely helpful as a resource for ISMP and is a current member of our Targeted Medication Safety Best Practices for Hospitals Advisory Panel. We truly appreciate Patty for her collaborative spirit and her tireless dedication to preventing medication errors and protecting patients. Thank you all for being with us this evening. None of this would have been possible without our generous supporters and contributors. We sincerely appreciate all the organizations and individuals who've helped us along our path. You're what makes it possible for us to honor safety leaders and trailblazers and continue with our own life-saving mission. I mentioned earlier, by the way, that we would be making a special announcement after the awards presentation. And ISMP has been planning several new beginnings that we're excited to share with you. Starting on January 1st, I'll be transitioning to the role of Professor Emeritus. Well, make that President Emeritus. I will be stepping back in terms of my work hours, but I'll still remain involved with the ISMP newsletters and other projects close to my heart. Everyone who knows me knows that I like to stay busy, but I am really happy to have the chance to spend a little bit more time with my family and also have some more time while still keeping my hand in things. Who knows? Maybe I'll even get to play some more golf. I'm also very pleased to announce that Rita Jew will be the new president of ISMP. I have such respect for Rita and faith in her ability to lead ISMP into its next chapter. She and I have worked side by side very closely since earlier this year. And honestly, I can't think of anyone better qualified to ensure that our mission continues. You'll be hearing more about these transitions when we make our formal public announcement. I'm really looking forward to the next stage of the journey. Thanks so much for the role that all of you played in ISMP's success. We've allocated additional time for networking at the conclusion of tonight's ceremony. So please feel free to stay and chat with your colleagues. And Rita and I will be in the breakout room if you'd like to stop by. Simply go to the breakout room tab on the Brella home screen to find us. And now, Dr. Marcus Schabacker, President and CEO of ECRI, would like to say a few words in closing. Marcus?
Ladies and gentlemen, tonight, as you just heard, an era starts to come to an end. While Mike will continue to support our work at ISMP and ECRI, a giant of patient safety has taken a step back. Since 1975, when Mike published the first error reporting program column in the Hospital Pharmacy Journal, Dr. Michael Cohen has been a beacon, a force to reckon with, an uncompromising and unwavering advocate for medication safety. His work and he himself have been a North Star for generations of pharmacists, nurses, clinicians, and physicians. His sage guidance has been sought after equally by those who make, regulate, prescribe, prepare, and administer drugs. He was, and he is, inspirational for all of us here at ISMP and ECRI, and I'm so glad that he will continue to be available to us. And Mike has ensured that his legacy will continue. With Dr. Rita Jew, he found a worthy and able successor, and we are looking forward to continuing working with her. And with forging the alliance between ISMP and ECRI, Mike has not only ensured that ISMP can continue its critical work, but together, our two organizations can chart new territories and even further evolve our efforts to advance evidence-based, effective, and safe healthcare globally. Tonight, Mike, we thank you and show our gratitude for your lifelong commitment and dedication to patient safety. Thank you, Mike, and we wish you all the best for your partial retirement. Now, all for me left is to say thank you to all of you for joining us tonight at our virtual Cheers Award ceremony, and congratulations again to all our awardees. I'm wishing you all a good night and a very happy and safe holiday season. Good night.